I am Dr. Felicia Enwezor, the Vaccine Director General at Nigerian Institute for Trypanosomiasis Research, Kaduna, based in Kaduna, Nigeria. I'm here on behalf of my family to make a case for inclusion and engagement of special needs nurses in handicapped schools, hostels in Nigeria, based on a fatal episode. Particularly for the visual presentation during the upcoming World Down Syndrome Congress in Dubai, November 2021. The presentation plan goes as this: have the family background, educational background, case for inclusion and engagement of special needs nurses in handicapped schools, hostels, cholera, trauma, physical aggression and tragic death, conclusion and recommendation. I want to begin saying that our family background, we are a happy family of 5 parents and 3 children. My second born, my first son, was born on 9th May 1981 and painfully exited this world on 4th July 2017. During the time of his birth, diagnosing his condition at that time was not easy. Suggestions of trisomy 21 as a result of imbalance in chromosome 21 was made, we were told then. And we wholeheartedly took care of our beloved son and was very supportive of him. We love him so much. We love him. My beloved, humble, and peaceful son was kindness personified and embraced his condition, embraced his life the way he found himself, with equanimity. As such attributes of intelligence, very supportive, observant, neat, and calm personality. It's such that must have his bath 2 times a day. And he ensured that things are kept in their rightful places. Ever cheerful, smiles, hugs unprecedented. As my beloved son, scaled the hurdles that life presented him with grace, slowly but steadily. Yes, he was steady, progressing steadily. He had such robust strength and life exuberance as he rarely fell ill. Very positive, peaceful, and warm dispositions. And all these traits endeared him to many people as he was such a peaceful, non-violent person. And in terms of educational background, we all know that every individual with or without disability has a right to life and quality education. My lovely son grew up manifesting impressive traits of good intelligence, strength and hard work at home, and in the many schools that he attended. Never minded spending fortunes to place him in private special schools to boost his integration and eventual rehabilitation, as that was on the lap. We're almost nearly there. As my first son, in January, I will recall, 2017, both of us went to Keja Immigration Office in Lagos to get his, where he diligently completed his biometrics. And when the passport was ready, we went together to collect his passport. And he signed himself. He signed his signature himself and was given his passport. We were trying to relocate him abroad for rehabilitation. Socialization, improved quality of life, and eventual rehabilitation is all the package that we have for my beloved son. During the time of 1981, he was born. and thereafter, subsequent years, they have no state government established places for people with special needs in Nigeria. The few that exist are run by private sector initiatives. But what is not clear is whether the private special schools have alliance with the state government. My beloved son joined one of the foundation schools in Lagos, Nigeria in January 2016 as a brother. Though he has been out of school, he also attended a similar one in Enugu, Nigeria, run by a German lady. And then now this one in Lagos. Returned home on holidays at the end of each term. So we are making a case for inclusion and engagement of special needs nurses in handicapped schools or hostels based on a factual episode. Because my little son, while in the school hostel in July 2017, caught cholera. And this cholera also affected 13 of his colleagues in the same hostel. So they say there was an outbreak of cholera in the school. And so we all know that special needs nurses, they combine medical and nursing skills in the care and management of patients, and particularly those with developmental disabilities. They are vulnerable people because they need an additional care or support that will help them to realize the optimum in life, their milestones in life. So it's important to include and engage special needs nurses in handicapped schools, hostels, for timely intervention for the overall safety and good health of our wards. Because a lack of such could result in ineffective and inefficient procedures with untold psychological and detrimental effects. Cholera, traumatic injury, physical aggression, and tragic death. Cholera is endemic with frequent outbreaks in Nigeria. And Down syndrome occurs 1 in 865 live births. Poor water, sanitation, and hygiene wash practices all know increased frequency of cholera and other gastroenteritis associated illnesses. Lagos University Teaching Hospital noted that my beloved son was brought in a deep comatose state with GCS 3/15. That is irreversible, the state of irreversible condition with electrolyte imbalance and urinary tract not properly charted. Who then informed the foundation that brought him and signed as next of kin on the need for placement in intensive care unit, but nothing was done, as he was left in accident of emergency unit. Luth also noted that despite being in a coma with seizures, my beloved son passed out a lot of rice water stool. And laboratory tests conducted on stool sample identified Vibrio cholera Ogawa strain as the primary causative agent of this illness. And the conclusion drawn was that he presented with hypovolemic shock, was in an irreversible stage of shock. The final inquiry also reported that cholera was treatable and preventable, as Luth successfully treated 13 other students of my beloved son's colleagues that had cholera also, but they did not have traumatic injury. Luth panel then concluded that the clinical outcome for my beloved son might have been different and not fatal had he been brought in for treatment, not in a comatose state or state of rejection. He was brought in a state of rejection. the state that said no hospital would even want to accept him. In our recommendations to this world body, we want to make a strong case for inclusion and engagement of special needs nurses in handicapped schools or hostels in Nigeria, given the students' vulnerability, as this will help to prevent or avoid careless deaths from cholera or any other wash-related diseases. We're also recommending and appealing for training of residential staff in first aid to ensure access to medical care arrangements on time. We're also appealing and urging the Congress to look into this, and also recommending that a strong monitoring mechanism be put in place and ensure that they work and tested regularly. As all this will help to promote and strengthen caregiving, quality caregiving for improved management of special needs. Not sentence them to non-first aid treatment or appalling care, injurious pain, psychological trauma, and death. Our prayers, we are praying the UN, United Nations, and the World Down Syndrome Congress to please consider and endorse this request for the inclusion and the engagement of special needs nurses in boarding schools or hostels for special disabled or vulnerable persons. We're also appealing and praying that the government should put in place functional monitoring systems for private sector involvement in special education, not just having it on paper, but in practice, ensuring that they practically work and enforce these regulations. Because if these regulations are enforced, my beloved son will not have died in this manner, in this condition, being brought in a comatose state. While in this school hostel in July 2017, where my beloved son caught cholera that also affected 13 other students, we believe that if monitoring systems have been put in place and enforced, it would not have gotten to this extent. No traumatic injury would have followed. No bringing in a comatose or rejected state that have happened. All these things would have been avoided, would have been prevented, because timely intervention of a prompt treatment would have ensued and followed. And my son would probably have been alive with me today, hugging me as he does. Very lovely and charming personality. We so much miss him. Till now, he missed us. The time he was living. So this will avoid the untold calamity and cruel fatality that befell my beloved son from happening again to any vulnerable persons in future. Yes, this is our appeal. This is our prayer, that we want the United Nations and the World Down Syndrome Congress to help us look into this, and that the discussions that will emanate on this will help to ensure that rightful decisions are taken for the overall good of people that are affected, vulnerable groups that need additional care. Because everybody needs everyone. Everybody needs care. Everybody needs support for the good of all concerned. We are not trying to belittle the foundation of the school that my son went to, not in any way, but we are trying to say that these things our request for inclusion and engagement of special needs nurses, for monitoring, strong monitoring mechanisms be put in place to avoid this kind of episode, fatal episode, because right now I cannot have my son back. The last 4 years have not been easy for me or my family members because of the trauma my son went through. There is a mother that took him to the school, but Zela Hadi never saw the mom. Ended up like this in a hostel. It's not been easy for me as well. And I never know whether it will ever be easy to cope with, because I live a life of regret. It's so sad that you end up like this. So please, but I want you people to help us so that my son's death will not be in vain. It doesn't happen to any other child or person that is in a special needs school. Because these things they are paid for. It's not that you spend fortune there. It's not that you abandon. No. Please help us. And I'm not saying that the school, I'm not belittling them. We are not belittling them. But we want improvement. We want quality of care. The level of care needs to be improved and quality improved. This is what we are saying. And that can only be done if we put the right people at the right places there, so that the needful can be done that has to do with life, with health, can be done, because there's an adage that says health is wealth. Can be done promptly and timely to avoid this kind of devastation, devastating demise and fatal death. Thank you very much for your kind attention. Thank you very much for listening. Once again, I thank you all.